Hello, my zebras and spoonies. Thanks for coming and hanging out with me today. I'm glad that you are here. Today, I'm going to be talking about psychotherapy for pain management. This is an often hot topic in the support groups that I am a part of. Uh, for reasons that I am all too familiar with, the knee jerk response to getting a referral to a therapist is that we are being dismissed. However, that might not be the case, and there is research to support the use of therapy for those with chronic illness. So let's get into it. So, my first recommendation is that if your provider is recommending that you see a therapist, you should clarify with them the reason that they think that you should be receiving this care. Ask them what they feel the benefits would be to you and what diagnosis they would use to make the referral. Those two pieces of information will tell you a great deal about what your provider is thinking and will help you decide whether or not the provider is dismissing your chronic illness into the psychiatry world. Your provider should be willing to discuss the rationale behind any recommendation that they are making. I personally think that it is a huge red flag if a provider is not willing to have this conversation. Good care is based upon a logical process of thought. Thus, they should be able to explain to you how they came to this recommendation. If they can't, it is an indication that there isn't a good foundation of reason for that recommendation. If they won't, it is an indication that they are more interested in maintaining power roles than creating a productive relationship with you. Either way, I would say that it's not a good provider relationship and that you should look elsewhere. The second thing that I have to say is that I am a huge advocate for taking care of our mental health. For those of you that don't already know, I am an RN and I have a ANCC Psychiatric Mental Health Nursing Board certification. Thus, I could be considered biased when I say that I feel almost everyone who has a chronic illness would benefit from receiving mental health services. Having a chronic illness means that you would be put into a grief cycle and it doesn't go away. And for that alone, it can be immensely helpful to have a therapist to talk to. Having chronic illness also means that you're going to have a bunch of stuff that you're thinking about and you're worried about, and you probably don't want to constantly dump on the people that you are close to. Because of this, having a therapist that specializes in chronic illness can be super helpful. It gives you a safe place to put all of that without burdening the people that are close to you. Not to mention that having a chronic illness increases the risk of having a mental health diagnosis, with depression and anxiety being really high on the list. So there are many benefits that a therapist can provide to someone with chronic illness, but the key is finding someone that specializes in chronic illness management. Because if they don't know anything about chronic illness, they're not really going to help you work through all the stuff that's going on with your chronic illness. The thing that I see questioned and debated in the support groups the most is having psychotherapy for chronic pain management. I'm going to focus my post on that topic. Psychotherapy for pain management can be very useful, but there are definitely things to keep in mind. I mean, like all therapy, it's only going to be as good as the therapist that you're working with. Because of this, don't be afraid to switch to a different therapist if the one that you're working with doesn't feel right or isn't helpful. Therapists are individuals with individual styles. It doesn't matter which approach of therapy that they're working with, CBT, DBT, ACT, doesn't matter. They're still going to have their own style. Getting CBT from two different therapists can be two completely different experiences. Not to mention that they are people. And just like when you are meeting anyone, there is the factor of personality. But this is someone that you're going to spend a good amount of time with, and it is someone that you're going to be talking to about some pretty personal stuff. So it really is pretty important that you actually like your therapist as a person. If you find their personality abrasive or triggering, it's going to be really hard to work with them regardless of how good they are at their job. So, cognitive behavioral therapy, or CBT, is the approach most often used when getting psychotherapy for chronic pain management. However, CBT doesn't help everyone. It is the type of therapy with the highest efficacy for chronic illness and chronic pain management, which is why it is the approach most often used. However, if this approach isn't working for you, then the second highest efficacy is acceptance and commitment therapy, or ACT, and it can be worth trying. So just keep in mind that while I'm going to be primarily talking about CBT, that there are other options and that they are definitely worth exploring, especially if you tried CBT and you find that it was not helpful. So, CBT is based on several core principles. The first principle is that psychological problems are based in part on faulty or unhelpful ways of thinking. The second principle is that psychological problems are based in part on learned patterns of unhelpful behavior. And then the third principle is that people suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more effective in their lives. So, in context of chronic pain management, CBT is going to sit on these same principles. The thought is that the way that we think about our pain can help or hinder us in how well we cope with or manage that pain. Learned patterns of behavior can contribute to a worsening of our pain symptoms. And we can learn better ways to cope with and manage our pain, thereby improving our pain and becoming more effective in our lives. CBT treatment usually involves efforts to change thinking patterns, and these strategies are going to include learning to recognize your distorted thinking that are creating problems and then reevaluating in them light of reality or an external perspective. Gaining a better understanding of the behavior and motivation of others, using problem solving skills to cope with difficult situations, and learning to develop a greater sense of confidence in your own ability. So, CBT still involves efforts to change thinking patterns when treating chronic pain. Evaluations of your emotions and your thoughts around your pain can help you better understand the relationship that you have with your pain. Being angry at or afraid of your pain can have an impact on the ways that you cope with and manage your pain. The relationship that we have with our pain will determine the behaviors that we engage in regarding our pain. And that's just going to have a major impact on our outcomes. There generally isn't too much focus on the understanding the behavior or motivation of others when you're receiving therapy for pain management. There will be a huge focus on helping you build problem solving and coping skills. And there's also going to be a huge focus on helping you feel more empowered in taking control of your pain management. CBT treatment also involves efforts to change behavioral patterns, and these strategies can include facing your fears instead of avoiding them, using role playing to prepare for potentially problematic interactions with others, and learning to calm your mind or relax your body. So, again, CBT is going to stay with its core treatment set when treating chronic pain. There's going to be a focus on facing your emotions regarding pain, which is commonly fear of having pain or increasing pain. Role playing might be used if you need help in learning how to self advocate or you're having a difficult time with having conversations regarding your pain. But generally, role playing isn't going to be used for pain management therapy. So relaxation skills, among other coping skills, are definitely going to be taught. It's going to be a very core part of pain management therapy. CBT is all about shifting the way that you think about things and using coping skills to better handle the symptoms that you are having. That being said, it generally doesn't reduce your pain. It can if stress is triggering flares or is making your symptoms worse. But what it generally does is improve your ability to tolerate your symptoms. Since being symptom free is generally not a realistic goal, hence the chronic nature, it really can be helpful to have a better toolkit for being able to tolerate those symptoms. Can also help you find a better mindset, for you to be a better problem solver, which can be helpful for pain management. Can also help you break out of harmful behavioral patterns that can be increasing your pain. If you're going to get CBT for pain management, make sure that the therapist you are seeing is a specialist in both CBT and chronic illness or chronic pain management. Other therapists are not going to be as helpful. It can be helpful to research potential therapists before committing to an appointment. Most therapists now have a website with their profile that you can read over. That profile generally covers their education and experience as well as what they focus on in their practice. So don't be afraid to give them a call for a brief interview as well. Most therapists will give you about 15 minutes of their time to answer questions about their practice. Just to keep in mind that they don't have secretaries as a general rule, and that they are likely to be in session when you call. And this means that they are most likely going to have to return your call between sessions or at the end of their day. So be patient. Lastly, keep in mind that there are other approaches than CBT that can be used for chronic pain management. So if a therapist seems like a good fit, they can be worth trying even if they aren't one that uses CBT. Remember that telehealth can increase your access to specialized providers. Most insurances now cover telehealth, and this is going to open up a lot more options for you getting the kind of therapist that you need. It can be helpful for you to call your insurance before you start looking for a therapist. Find out what kind of services are covered, what types of appointments are covered, and find out if the licensure of the therapist matters for them to be covered. Oftentimes, your insurance will have a list of therapists that accept their insurances and that are in the preferred group. This list can be a great place to start your search since you know that your insurance is going to cover them. After all, it doesn't matter how amazing a therapist is if you can't afford to go see them. Know that there are several types of licensure for therapists. So there are advanced practice psychiatric nurse, and they are the PMHNPs, or the psychiatric mental health nurse practitioners. There are also the licensed clinical social workers, or the LCSW. They're clinical psychologists, and they're CP, and there are psychiatrists, or MDs, and they are usually presented as Dr. Blank. Each license has a different scope of practice. The biggest thing to know is that you need a PMHNP or an MD if you're going to be prescribed medications. Generally, these two licenses will have more of a focus on medication than counseling or talk therapy. So it isn't a matter of one license being better than the other, but rather knowing what services that they can provide and what their focus of treatment is likely going to be. It is also important to know if your insurance covers the kind of provider that you're going to be seeing for talk therapy. As a final note, I personally found ACT and ERPT way more helpful than CBT, and this is because I personally have autism and OCD, which both tend to respond better to ACT and ERPT. ACT is acceptance and commitment therapy, which has a focus on learning how to sit with uncomfortable states of being and being functional in those states rather than trying to change your state of being. ERPT is exposure response prevention therapy, which is based on ACT, but then actively exposes you to the things that trigger uncomfortable feelings as a way to train you to better cope with them. So those with autism often have strong OCD traits, even if not meeting the full criteria for an OCD diagnosis. And this means that things like intrusive thoughts, ritualized behavior, and need for sameness can often be barriers for CBT. Those with OCD or OCD traits often find it difficult or impossible to change their thoughts. I mean, this is the nature of having obsessions. So ACT and ERCPT are the gold standard for those with OCD and OCD related disorders or OCD traits, and can be more helpful if you fall underneath that umbrella. Just something to kind of keep in mind. So that's about it for my rambling today. Thanks for coming and spending some time with me. If you like the video, please click on the like button. It really does help. And until we talk again, you guys, please take care of yourselves. And I hope that you are doing well. Bye.